Hello, everyone. This presentation is to supplement the information that we will cover later on treatment options. And I am a clinician. This is my specialty, although I am going to present some information that will be my opinion. I don't do all of these therapies, so I'm not expected to know everything. And I think that we have a big tent in psychology, so there is room for people who maybe see things a little bit differently than I do. And I own that, so that's okay. And I can't know about everything, but I'm going to hit some highlights. There will be things that I won't cover. For example, hypnosis, I'm not going to cover that. So, and interpersonal therapy, I'm not going to cover that. So this isn't everything, but I'm going to hit a few highlights, and hopefully you learned something. So our agenda is I'm going to talk to you about the history of treatment in psychotherapy, counseling, whatever you decide that you want to call it. But I'm going to focus on some current evidence-based practices like cognitive behavioral therapy, acceptance and commitment therapy, dialectical behavior therapy, and trauma-based therapies, as well as a few others. So again, those are going to be the things that we cover, and let's jump right in. I do want to say at the front end that I would like for you to email me one thing that you learned and your favorite therapeutic approach and why. And if you send me that, I will give you credit for completing this in your grade. All right. So when we think about therapy, it originally started with Freudian therapy, which was psychoanalytic therapy. And this is probably the stereotype that a lot of people think of or comes to mind when you think about therapy, and that's laying on the couch. So the way Freudians did therapy was not interacting so much with the person who was talking. So the person would lay on the couch or sit back, and the therapist would have his or her back then it was probably more his back toward the patient. So there would be no influence. And the person who was laying on the couch would free associate, meaning talk about whatever comes to mind. And with very little interaction with the therapist, the thought was that the person who was just sort of talking about everything would work out their own problems. Psychoanalysis is still done some presently, but not as often. It's very costly because people could be in psychoanalysis for years and years and years, every week, maybe sometimes multiple times a week, working through their problems. And with very little therapist input, you can see why it would take a long time. So this kind of therapy really is probably best suited for people who are very intelligent, very insightful, very reflective. And if you needed more influence, then you weren't really getting your needs met. Psychodynamic therapy is, I guess I would think of it as more an update on analysis. It is more interactive. And when I think of psychodynamic therapy, I think of we do focus on what's in the unconscious or the subconscious, and we're aware that people have those influences that they're not aware of, and we're trying to bring those out. And sometimes those dynamics work out in therapy with the therapist. So we see people play out patterns of behavior that they have outside of life in the therapy suite. So psychodynamic is not the same thing as psychoanalysis, but the point that is kind of the same is that there is a lot going on in our unconscious and subconscious that can come out by just talking, right? So when I talk about evidence-based practice, I'm talking about the things that we study. And why this is important is I like to think of providing evidence-based care as being respectful of the healthcare dollar. As you could imagine, it would be very expensive to pay for analysis. Insurance doesn't pay for that for years and years and years, once or twice a week, out of pocket. And I don't think that, well, historically that wasn't studied in terms of effectiveness. And it's not, I guess, would not be considered to be an effective use of our healthcare dollars today. So what I'm going to focus on are some of the more well-studied evidence-based practices. That being said, I'm not necessarily saying that you shouldn't do psychoanalysis or that it's not helpful for some people. I'm just saying that it's not considered one of the more mainstream evidence-based practices. That being said, the research on evidence-based practice suggests that the most important piece is the therapeutic relationship, meaning how you feel about the therapist. Do you trust the person? And do you feel like there is a trusting relationship, a healthy relationship? Because if you do, then that seems to predict the best outcomes. If you don't like your therapist or you don't trust them or you're just not sure or you feel judged or you don't feel like it's a safe place, you're probably not going to get the benefit. So it goes to your belief, I guess, in that relationship. That being said, there's a term called eclectic. Eclectic means somebody who takes techniques from multiple practices or multiple theories to apply them to the patient. And I use the term patient. Other people use client. I guess when I think of the way I was trained is I do tend to use the word patient because I practice a lot in hospital and medical based situations, but a person's paying me to treat them and to apply a certain therapy. Other people, again, use client, which I guess I'm rubbed a little bit wrong when I think of customer, because I just don't think of my work as like that. I guess that business like, but it is, and it's okay to do that. It's just a difference. But eclectic therapy, the reason why I point that out is because I guess the best practice would be you pay attention to the person who comes in and you meet their needs, meaning if I'm the therapist, I kind of adjust what I do to meet the needs of the person coming in. And that might be using techniques from multiple practices. But that being said, my bias is I do believe that therapy needs to involve homework. So, again, I think that a lot of therapies are still have a strong influence of non directional theory, meaning the idea that therapy is really just about listening and reflecting back and, oh, I heard you say, and this is how you feel, or how do you feel? And just being very sort of non directive. I'm not a huge fan of that. Now, don't get me wrong, there are times when I do use that and it does inform my work. But I think, in and of itself, for a lot of problems that people bring in, they need more. So I do tend to be more, I guess, challenging to people. I do tend to give more homework and be more goal focused, doing more short term therapy, because I think if people, um, I guess I think of non directiveness, sometimes that's they're paying for more, I guess. And I do, again, I am biased in that regard. If somebody comes in for grief and they're very sad, I'm not like saying, okay, here's your, I'm not pushy saying challenging in that way and saying you have to do this homework. I do tend to be more non-directive in those circumstances, but I still ask directive questions. So beyond that, here we go. Cognitive behavioral therapy. You'll hear a lot about this. It's well studied and it lends itself to being studied. So here's my metaphor, I guess. I want you to think of everybody comes to this earth a crock pot, and everybody has a basic broth. Some people are chicken, some people are vegetables, some people are combination beef, chicken, vegetable, whatever. That's your genetic piece. And then from the age 0 to age 18, all your life experiences are like ingredients being thrown into your slow cooker. And age 18, ding, the timer goes off, you're cooked. I'm talking about your personality. And think about your personality as everything that makes you, you. It's how you see the world, how you see yourself, how you see other people. And so that's what I'm talking about, beliefs. And I want you to think of beliefs as filters that we have. And some of the genetic traits that you're born with that are in your broth are maybe like introversion, extroversion, or optimism, pessimism, perfectionism. If you're a warrior, maybe you're born that way. Those are your genetic, that's part of your genetic code. And then your first 18 years of life, all your experiences, how your parents treat you, how your peers treat you, the things you learn you're good at, those all influence how you see yourself, the world, and other people. but they're filters, meaning we can distort things. For example, let's say that I have this not good enough belief, like nothing I do is ever good enough. If somebody gives me a compliment, I think, oh, you're just saying that. You're just being nice. So we all have those, but we get some problematic beliefs like not good enough, or everybody should like me. I have to please everyone. Or sometimes we get too much guilt in our recipe. Well, those distortions, those beliefs, shape our thoughts. And I want you to think of our thoughts as self-talk. This is the voice in your head that's talking nonstop all the time, kind of narrating your life. And it's okay if it's just commenting, but when it gets negative and critical, like you're no good, you're not good enough, no one's ever going to love you, all you do is make mistakes, I can't believe you did that, this is terrible, this was awful. And what if my headache's a brain tumor? And what if no one likes me? And what if things don't go my way? Whatever we're saying to ourselves shapes our feelings. Because again, if you're saying terrible things, then you feel terrible, or you feel beaten up, or you feel anxious. And their feelings shape our behaviors. So maybe we're feeling awful, so we don't get out of bed, or maybe we chew our nails, or maybe we eat too much, or maybe we drink too much, or maybe we pick a fight. So people oftentimes seek therapy because they don't like how they feel, and they also don't like their behavior. But we got to go back and say, let's look at the programming and the things that we're saying to ourselves. And if we can change those things, then we will feel better. And sometimes we just change our behavior. Like when we do things that we know we shouldn't do because it makes us feel lousy, then maybe we just stop ourselves from doing those things. That's cognitive behavioral therapy in a nutshell. So just as a fun aside, I thought I would give you some of my favorite reads associated with the different therapies. The Feeling Good Handbook is an old book. However, it's big. It's one of my favorites for depression or anxiety or just general application of cognitive behavioral therapy. The Anxiety and Phobia Workbook is my absolute favorite for dealing with anxiety, but these are self-help books. So these are for people who like to read, who are going to do the activities, and they are true CBT books. Acceptance and Commitment Therapy. This is basically therapy, by the way, that's often used in combination with cognitive behavioral therapy, but you're aware of things that are going on in your mind, but you just say, oh, I notice I say those things a lot. I notice I beat myself up a lot. I notice my brain is saying this right now, and I'm just going to let that play out, and I'm not going to get involved in it. And so it's mindfulness in the sense that we're paying attention to what's going on, but a purposeful detachment, because it's reminding ourselves that we want to live our values. And when our life gets out of sync with our values, then we're off kilter, or we're not being our best selves. And it's also about radically accepting even the things that we don't like. Like maybe we get bad news and we don't want that, right? But the more we fight it, the more we create our own suffering. So it is saying, okay, I'm going to embrace the suck here so that I can move beyond it. So it is, again, living our values, being mindful, saying, if indeed I say that my health is important to me, then I need to do things that reinforce my health. And so again, the difference, CBT is you argue your thoughts. Acceptance and commitment is like you just notice and you say, gosh, I do those things, but that's not healthy, and I'm going to work to create some space. That's another activity, is expansion. I'm going to create some space for these things that I don't like because I'm creating my own pain, so to speak. And I have a lot of recommendations. You'll see Russ Harris is one of my favorite authors around mindfulness and acceptance and commitment. The Precious Present is a short book that's probably one of my favorite books ever, because it's a very simplistic book, but it teaches a lot. You could read it over and over and get different things. But The Happiness Trap is looking at how we get in the way of our own happiness and letting go. And living a life aligned with our values. The Reality Slap is more focused on when life hurts, when we get bad news, and how do we continue on in spite of that bad news, both by Russ Harris. But Russ Harris also has When Life Hits Hard, which is a grief workbook. And I really like it. when you want to do a more workbook activity, again, focused on grief, because grief tends to be the hardest to kind of accept when horrible things happen that really hurt our soul. Right. So dialectical behavioral therapy is it's one of the newer therapies, but it is most associated with a diagnosis of borderline personality disorder. But it has many other uses. Dialectical behavioral therapy, I think, is probably the most abused, in my opinion, because people say they do it, but they don't do it according to protocol. Protocol involves weekly individual therapy, but also weekly group therapy. So you're working on skill, really, really hard on skill acquisition and noticing how your mind creates these dialectical thoughts, meaning opposite thoughts, like things are wonderful and they're horrible, or people are, I hate them, but I don't want to lose them. So these very opposite thoughts, and learning to bring forth something called wise mind, which is sort of like the adult in you that says, okay, I notice I've just kind of gone off kilter. What do I want to do about that? How can I calm myself down? How can I learn to tolerate distressful situations, calm myself down, soothe, and emotional regulation? So again, cueing that frontal lobe, just because I think it doesn't mean I need to say it or act on it. And there's, again, very specific skills that I'm not going to go into, certainly not something I'm an expert in. Like, for example, instead of cutting oneself or hurting oneself or doing something self-defeating, maybe you squeeze an ice cube, or you do something to interrupt that circuit in the brain. And in DBT, probably more than any other therapy, you develop a pretty specific treatment plan, a list of things that you can do to help yourself in a moment when you're feeling flooded with emotion. Again, very simplistic. Don't know everything about DBT, but there are a lot of really cool DBT workbooks. Again, this is not DBT therapy, because DBT therapy is, again, very protocol driven, meaning you do individual and group therapy, and typically you're going to commit to like a year of doing that. But there are lots of workbooks that have great skills in them that I tend to recommend to people if they just want to try some of the techniques and you feel like you're able to develop your own treatment plan. Some of the more trauma-based therapies, I think are important to cover, because a lot of therapies out there for trauma, people could go for years and years and years and just keep going over their trauma, but not really learning the skills to manage it. And we have in the scientific literature a lot of evidence to show that there are specific treatments that are very effective, and they're not necessarily being employed in therapy. Meaning, when somebody's been through a trauma, I like to think I could help them get some relief more quickly and being more directive, instead of just let's keep playing it out and venting and just listening to people. I think that there are more skills that we can teach. Exposure therapy really came out of the idea of exposing people to what they're most afraid of and that they're avoiding can help them learn mastery or even habituation, meaning what you face is more familiar to you and you realize, gosh, I can handle that. But then really horrible things that we have, that's great for, like, let's say that you're in a car accident and you're afraid to ride in a car, but you're flooded with emotion. We can say, okay, let's get you back into the car and be exposed to that, and then you can remaster it. But that therapy is not so great if somebody, for example, hurts you, or you're in war, or something that is psychologically traumatic in that way. So there are other sorts of therapies that we have, like written exposure therapy, where people are actually doing expressive writing over the course of 5 visits and taking the language part of the brain and reintegrating all of those experiences, sights and smells and sounds and emotions, and you're putting them back together through language. And there's a lot of evidence that's highly effective in managing trauma. Cognitive processing therapy is also highly effective. It takes longer than written exposure therapy, but it's the process of the therapist catching those negative thoughts or those negative appraisals that are tripping you up along the way. Something terrible happens, and maybe you're looking at through your biased lens and saying things that are not so helpful to you. Cognitive processing therapy and written exposure therapy are probably pretty equal in their efficacy. It's just that CPT is longer term. I don't necessarily mean long term, but just take a little bit longer than the 5 visits. The thing I want to point out about all trauma-based therapies, by the way, is they involve exposure, meaning what we know doesn't work is avoidance. So people typically do try to numb and avoid, drink, use marijuana, which is not a treatment for trauma, despite what you may hear. But we know if we can get you to address it or face it in a healthy way with skills, that you will feel better, that the more you avoid, the worse you feel. So probably the one that I know the least about is eye movement desensitization reprocessing. So I'm going to be really, sketchy here. It is what I read the book a long time ago, but I don't do this kind of work. But it's essentially you're talking about what happened in the process of following the therapist who is moving a finger or moving something in front of your face, and you're following it with your eyes while you're talking about what is happening, and it's helping your brain reprocess. I think that I've heard that people are doing EMDR for different, like just life stress, and they're doing it on the computer. I don't really know how well studied that is. I know that EMDR has been studied for trauma in person, and that there is evidence to suggest that it's helpful. Probably what is most helpful is how much you believe that the therapy is going to help. And again, your relationship with the therapist and the trust, especially in trauma, you need to trust the person that you're working with. But if you believe it's going to help, it's probably going to be helpful. So 2 of my favorite books around trauma are Writing to Heal. Now, Writing to Heal isn't necessarily just for trauma, but it is the self-help version about writing about things that are troubling to you. I'm not recommending that as a trauma therapy. I'm just saying that written exposure therapy, the protocol came from the original work of James Pennebaker, and which he suggests, or he talks about in Writing to Heal. And he is not promoting Writing to Heal as a trauma-based therapy, but it is something that you can do for yourself. Self-help, so to speak. The Body Keeps Score is Bessel van der Kolk, and I think it's a great book about the brain, the mind, the body, all the stuff that's going on to help you understand a trauma response. It's not a treatment of trauma. It does talk about the effective techniques to treat trauma, but I guess I'm a little hesitant to provide self-help around trauma simply because a lot can come up. And I think my bias is it can be helpful to do trauma therapy with a therapist, even if you're doing things on your own. Anyway, so those might be things to check out. All right. Motivational interviewing. Motivational interviewing is a technique that is often used to treat substance use disorders, but we also use it for lifestyle habit changes or compulsive disorders. So when I think of compulsive disorders, like let's say that you're thinking about porn a lot and then you want to go look at porn and it's causing problems in your life, or maybe you're chewing your nails, the lifestyle habit change, or people who want to change maybe the things that they eat and that sort of thing. So motivational interviewing really came out of non-directive therapy, meaning the non-judgmental, safe, unconditional, positive regard environment is super important to motivational interviewing. But motivational interviewing is really you're asking very reflective questions to get people to think and to point out discrepancies in how they're viewing a situation. And you're trying to create dissonance, meaning a gap between where a person is and where they say that they want to be. So you're meeting them where they are. which I bring up the stages of change, which is James Prochaska's model. So, in order for motivational interviewing to be effective, you have to look at where people are in their readiness to change. Pre-contemplation being, I don't have a problem. So, maybe other people think I have a problem, but I don't have a problem. Contemplation is, maybe I have a problem. I'm not sure. I need more information. Preparation is, I have a problem. I need a plan. And by the way, this is where a lot of people fail because they jump right into action without making a plan. And I often say, look, like at work, if you're going to make a big change, usually you're going to have some sort of project management. You're going to have a plan. You're going to have, if then, if this goes wrong, then we'll do this, and have some sort of contingency set up so that you can be ready. And I think oftentimes people get excited and they just jump into action without really coming up with a plan, which then leads to other problems. And then people feel they don't get the results they want. They give up. They feel like a failure. So preparation is a super important piece. And then action is, I have a problem. I have a plan. I'm working the plan. But maintenance is where most people fall off the wagon. And maintenance is, I have a problem. I have a plan. I'm working the plan. I'm probably always going to have to work the plan, which really sucks because nobody wants to do that. But when you let your guard down, that's when people fall back into their old ways. So motivational interviewing is a technique that we use to meet people where they are and just get them to think about what they want and what might be the best course of action. But it's just to stimulate thought. So, for example, where do you think you're going to be in 5 years if you don't make a change? Or why is this important to you? So probably some of the values come in with that as well. Therapy with children is, again, beyond my specialty. There are play therapies, but CBT, cognitive behavioral therapy, and acceptance and commitment therapy, and mindfulness, and doing some of the self-soothing, some of the things that we do with adults, we absolutely do with children. And I think it's important to do that. I, again, have a bias. I think with a lot of child therapy, it is non-directive and kids can go and go and go and go. And they're not really learning the skills to take care of themselves or to problem solve. That being said, I think that non-directive therapy with children is super important because we're helping them identify their feelings and have a safe place to talk about those feelings. But I guess what I'm saying is I think that we can do both. So I do have in the middle the kids' workbooks by Dawn Hubner, and she has a lot. The one I have on here is What to Do When You Worry Too Much, What to Do When You Dread Your Bed, What to Do When Anger Takes Hold. These are CBT workbooks for kids, and they're fabulous. On this page, I just have miscellaneous recommendations. Brene Brown, if you haven't heard of Brene Brown, you should look up Brene Brown. She has a lot of work on shame, imperfection, perfectionistic thinking. So I just have on here, anything by Brene Brown is wonderful. Intimate relationships, I really like John Gottman's work because it is evidence-based. He studied people in his lab. And even though this says 7 principles for making marriage work, Gottman does say there's no reason to think that these principles don't apply to people who are just in long-term committed relationships. I really like it. It has a lot of good activities for people to do. I also, if you like the idea of doing your own sort of self-help stuff, New Harbinger is a fabulous resource because they only publish workbooks that are written by professionals that are evidence-based. And I just have this example, Disentangling from Emotionally Immature People. This title tends to resonate with a lot of folks, but New Harbinger is a great place to explore self-help workbooks if you're interested in that. One of the newer topics in therapy is this idea of teletherapy, because you can get on the computer and get a consultation or do therapy via computer, especially took off during COVID because there weren't a lot of people who were seeing folks in person. And I think that there are a lot of great uses of teletherapy. I think teens are particularly enjoying teletherapy because it's much more comfortable with technology, there are challenges as well. I tried teletherapy a bit and you mean providing it, and I don't love it. I feel too disconnected. It's too easy when I'm sitting in front of the computer to get distracted by things going on in the environment. I don't feel really connected to people. I like being in the same room, and so I don't love it, but I can see that some other people would, and I don't discourage that. I know that also there are some places in the world, in our country, and the world in general, where you don't have a therapist that you can get in to see in person, and so it's most important that you have somebody to connect with. But I think that for people who like it, and for people who are able to connect that way, there is benefit. They're able to show that there are beneficial outcomes. I think it's another tool, but it needs to be something that fits for you personally. I find talking to somebody over the computer, I sometimes feel not as connected, meaning a little bit more lonely. But anyway, teletherapy is absolutely a tool that you can use. It is important that for people who are doing teletherapy, that their therapist knows what resources are in their community, so that there can be appropriate referrals if you need more. So for you, on that note, I want to provide resources for you in case I said something that connected for you and you think, gosh, I want to go explore therapy. At U of M Flint, you have the counseling and psychological services, which I believe you should be able to get a certain number of free counseling visits. So certainly take advantage of that if something looks interesting to you. At the top, I have the link for psychologytoday.com, which you put in your zip code, and then you can click filters like if you want a male or female or non-binary therapist. If you want, somebody who speaks a certain language or deals with a certain problem, you can put that in there. And people who have profiles, they usually have their photo, sometimes a video, and a little bit more of a bio on them. So you can pick somebody within your zip code, a certain number of miles, or who takes your insurance. That's another option. I also include the domestic violence hotline information, which is in the Here For You for people who are experiencing abuse. There are resources. Most counties have a domestic violence shelter, but this is the national link for you. And then the 988 suicide and crisis lifeline exists if you need immediate help. Just know, I guess the point of this is there are a lot of resources, and these aren't exhaustive, but you're never alone. And I think that's probably what a lot of people struggle with, is just feeling like so different. No, not understood, completely alone, and you're not alone. And I think that's probably one of the most beneficial parts of therapy, is getting away from that isolation and realizing that you're not so different or alone. At least that's what I think is, in my opinion, one of the most healing parts of therapy. All right, so I am now going to mention my self-help books, and if you're offended by cuss words, you probably want to shut it off, and it's fine. I'm not going to ask you about any of this. It's fine if you log off now, and you're certainly not required to listen to me talk about my books, but I thought I would mention my stuff sort of at the end. I am a huge believer in humor in terms of being able to laugh at oneself in one situation. Not everything is funny. And so my books aren't meant for trauma. My books aren't meant for more significant psychological problems. My books are absolutely self-help, but more stress-based or anxiety-based, and again, relationship-based. But I have an inspirational one as well. Again, you don't, trigger warning, I have some cuss words in my title, so you can log off, and I'm not going to ask you about any of this. So these are my titles. I mentioned to you at some point that there's an evidence base to suggest that, for example, if you're walking through the living room and you stub your toe and you yell out a cuss word, that people report the cathartic effect of letting out that cuss word reduces pain. So that underlies some of my Move On Motherfucker, Live, Laugh, and Let Shit Go title. Is that book is based on the real research evidence combining CBT, mindfulness, and humor, and with a curse word or two to get to invoke laughter, to let go of pain. And so I do say it's using science to reinforce sometimes our worst habits, right? Uh, Excuse me, my Getting to Good Riddance, a no bullshit breakup survival guide is really about toxic relationships and breaking up with bullshit. Breaking up and getting over breakups are very difficult. They really cut us to our core. And so I try to throw out everything I can think of to help people manage that transition to a better place. And then my most recent book is Badass Stories, Grit, Growth, Hope, and Healing in the Shit Show. And I guess I would say that this is a compilation of some of the most healing stories, real life stories that I think can be inspirational, but also really helpful for people who care too much. And it's seeing that we can be helpful in so many different ways that maybe sometimes we're not even paying attention to. But anyway, I tried to throw out some stories that I thought would resonate with a lot of people. That being said, I do post things try to post inspirational psychological things with humor and profanity on my social media. And I just throw this out there if that would be of use to anybody beyond this class. I hope this was a useful lecture, and I hope that you at some point go for counseling, because I tend to have a bias that it's helpful for a lot of people. And hopefully I've given you some direction about what to look for.